and welcome back to another episode of the Resting Stitch Face podcast. I'm your host, Dr. Erin Sheffield, with my co-host,
Dr. Sarah Harding. Hello.
Welcome back. We are so excited to be here today. We have a new guest, Katie Walker. Katie, can you introduce yourself to our audience?
For sure. I am in the medical field, so I'm a CRNA and I'm also a psychiatric nurse practitioner. Most people I don't feel like know what either of those titles are, maybe. But the CRNA aspect, I did anesthesia in the hospital for about 8 years. Prior to going to anesthesia school, I was ICU nurse at a level 1 trauma center for about 10 years. And then I decided it was a good idea to open a ketamine clinic in 2018 and did that for 4 years before I went back and got my psychiatric nurse practitioner.
Wow.
And then that's all I do now is ketamine. I've been doing that since 2018. So I've given about 25,000 infusions, maybe a little more than that. And really, I've gotten to learn a whole new world outside of the Western medicine hospital box. So I was in the hospital from 2003 until 2018. And then I've been outside the hospital in the outpatient space since then.
Wow. And you are in Tennessee, right? You're
I
around
am
the Knoxville area?
Tennessee.
Okay.
Mm-hmm.
That's cool. And then you own Revitalist now, which
I
is
do.
the ketamine infusion clinic. And you guys are doing a lot of things. And so
Yeah.
the space of ketamine infusion, how did you get interested in doing that?
That's a good question. Sometimes I question it myself.
Don't we all?
Yeah. So ketamine, anesthesia, we do ketamine. I know that well, but I was actually reading studies in 2016 about ketamine and seeing the results. And honestly, I was doing a glioblastoma and it was like an 8-hour case. And, I don't know if you know this, but like typically, neurosurgeons, we have different things that we have to do from an anesthesia standpoint. And one of my goals after the 8-hour case was to wake up the patient in 20 minutes, make sure they moved all extremities. And even after that long case, the guy still had about 6 weeks to live. And I was sitting there and I'd read about ketamine and saw all those really cool statistics. And I thought, what would happen if I was actually in the front instead of actually at the end of life? Because in anesthesia, we're like the most advanced trained people to help you not to die. And it's like, what happens if you actually push me out to the front with these people that are honestly kind of in end stage brain failure when they're wanting to kill themselves? And what happens if we can actually fix that situation? Because that body is a very viable body. That brain's a very viable brain. And if you can just help me to go up to the front lines instead of the end of the lines, how could we change the quality of life?
Interesting.
So I started that in 2018. And then, gosh, I saw the failures. I still see the failures. I tell people all the time, and I feel like I can say this since I went back and got my psychiatric degree. I firmly believe that the mental health system is a failure, period. I mean, you guys as oral surgeons, if you had the results, if you had the statistics that the mental health field has, if I had those statistics in anesthesia or neurosurgery or cardiothoracics, whatever, one, they would take our license. Because it's that bad, right?
Yeah.
I had no idea. It's like 30 to 40% effective, the medications that are
Right.
out there. And it's a life sentence.
Are you talking about severe depression or statistic?
of
Are you
it.
talking about in general? Okay.
Depression, anxiety, OCD, PTSD, suicidality. Everybody's scared to death. If somebody says they want to kill themselves, everybody they just run away. And I'm like, hold on, wait a minute, guys. What are you doing? Why are you not helping these people? And they're so scared of everything. And my personal opinion is we're all going to die sometime. Why not help the person actually live a higher quality of life prior to? But since being around ketamine and seeing the psychedelic space, which everyone's going to see this come to the market, we're going to see efficacy rates that actually start matching some of the normal Western medicine rates, which will be really, really exciting because I don't see how many of these people are still living. I mean, honestly,
Right.
they're like, I've been on 26 medications since 1983. I've tried to hang myself 3 times. And it's just like, how are you still here?
Yeah.
So a lot of people have such endurance. And I tell them all the time that they're not treatment resistant. I
Right.
say, you're not treatment resistant. The options we're giving you are no good.
Right.
And
Well, and then they're
yeah.
labeling themselves, now I'm a failure. Because obviously nothing that we have is working on me. I'm the failure. There's something even more wrong with me. And it just continues to spiral.
Yep.
It's just really
Yeah.
sad.
And if you start looking at it, I mean, Gosh, if you start looking at the data, right, like the physiology of it, everybody thinks, oh, you have a dopamine deficiency, you have a serotonin deficiency, whatever else. They're seeing that these neurotransmitters actually travel in pairs. So if you start changing your serotonin, you're changing your dopamine, you're changing your norepi, you're changing your epi, you're changing the entire landscape.
Mhm.
And it's like, again, can we just admit failure and just close the book and just start over? And I'm hoping that the psychedelic space will allow us to do that. But two, I'm also scared to death of that because
Yes.
people in the community who feel like they have more pharmacologic training than other people who've had training for maybe 10 years, they're going to challenge the Western medicine world. And we're going to see successes and failures, but hopefully it's going to be better than what we have now.
So, as oral surgeons, we use ketamine all the time in our practices for anesthesia purposes, which you are very familiar with as a CRNA. But
And this is what
what
has
is
blown my
the
mind.
yeah, what is the idea behind therapeutic ketamine in this space? What are the similarities to what we're doing from the anesthesia standpoint? What are the differences, and maybe what are the risks or like the things that patients need to consider when wondering if this is for them?
Yeah, no, that's a great question. Ketamine in this fashion, from a mental health standpoint and from a chronic pain standpoint. So ketamine is treating all kinds of conditions. I mean, depression, anxiety, suicidality, OCD, psoriatic arthritis, rheumatoid, just weird pain syndromes. We've had people on 8 milligrams of Dilaudid and been able to taper them down completely. Different things like that. But the dosing, right? The dosing with ketamine IV, the baseline dose that causes the neuroplasticity is 0.5 milligram per kilogram. So that's how we know that we're hitting what we need to hit from a physiologic standpoint. But me personally, like I have my own thought process, my own theories now after just sitting there and just looking at everybody trying to figure out what the heck is your brain doing. And me personally, I start them off at 0.5 milligram per kilogram, but my goal is to get them to where their brain feels neutral. And that neutrality is where they feel disconnected from depression and anxiety. So you are utilizing ketamine from the disassociative aspect. But if you can do that, it's almost like the brain, from a psychological standpoint, can start rewriting its narrative. Like I tell people all the time, reframe your narrative, reframe your narrative. And a lot of people can't, but they can if they get to that neutral place. Now in anesthesia, I don't know the dose that you guys use in oral surgery, but we would use 2 to 5 milligrams per kilogram IV push, if we were doing a anesthetic with it. And what that does, and I don't know again what you all do, but we would give, Versed or propofol or whatever to counteract those side effects, because the side effects are horrible. But what you're doing from that standpoint is you have the level of disassociation. Right. And I was not taught necessarily disassociation in anesthesia school, but I sure saw it when I started doing
Yeah.
ketamine.
Yeah.
But there's basically 5 levels of disassociation, so it's like none, mild, moderate, severe, extreme. And if it's extreme, it makes people look like they're 1D. Like, I don't know if you've ever seen the movie Inside Out. You seen
Yes.
that movie?
Yeah.
Where they go through the incinerator and they turn it
I don't
on.
remember this part. Yeah.
So they go from 4D to 3D to 2D to 1D. So
Okay.
ketamine at extreme disassociation, the world will stop. You look like a square. Actually, I've been told I look like Legos.
Oh,
So
that's fun.
but it can
They make
become
movies
really
like that.
yeah, right. Yeah, I've heard, people are like, I feel like I'm in the Matrix.
Yeah.
But those are levels of extreme. So you don't want somebody who's having ketamine IV, you do not want them to go to levels of severe extreme disassociation, because it can be traumatizing. When you hear people say, I went to the K-hole, or I had a K-hole, or I was scared to death, I felt like I died, all these things, those are severe levels of disassociation. When you give the IV piece, say you're giving 40 milligrams over 40 minutes, you're giving 1 milligram per minute. Like, it's significantly, I tell people it's like 1/3000th of a dose as to what we would actually recommend. And it's interesting too, right? Because ketamine, when you give it through mental health standpoint, it makes people have dry mouth. Which, when you're giving it, I'm sure through dentistry and also through anesthesia, like we used to give Robenal to
Mhm.
counteract the drooling effects that ketamine causes. Does not cause people to drool at all. They do not lose their swallowing reflex. They don't have any of that. So it acts as a psychedelic And if you look at psilocybin, if you look at LSD, they have similar psychedelic effects as ketamine. But ketamine, from a chemical standpoint, is most closely related to ibogaine that's starting to gain
Right.
some traction. But honestly, used to, I would tell people they need to fail at least 2 antidepressants before trying ketamine because that was the traditional treatment resistant. Now, I firmly do not believe that.
Mhm.
I personally believe when their function starts decreasing, and it's like, I just don't feel right. I'm not sleeping. I'm so stressed. I can't turn my mind off. Those are candidates for ketamine. And it's so safe, right? It has a
Right,
huge
that's what I was
safety
gonna say.
index.
Yeah.
Yeah. To where and when you do it IV, like me personally, I titrate it to effect. If it's too intense, you slow it down. If it's not intense enough, you add more. So it's
And you're not
allowing
getting the
them.
serotonergic activation either, right? So we're not
Right.
necessarily concerned with
Ketamine works more so on your glutamatergic
yeah.
receptors. Yeah, so you don't have to worry. And she gets along with everything. You know, the only
Mhm,
drugs that ketamine doesn't like, benzodiazepine, cannabis, and alcohol, but it acts as an antagonistic more
mm,
so. It
okay.
just makes it less responsive. It doesn't make it more responsive. But you know, the youngest person we treated is 12. The oldest we treated is 92. I've had people with
Wow.
ruptured aneurysms. I've had people with, actually heart transplants. We've had liver transplants, and again, that's probably my anesthesia background that I feel comfortable with those individuals, but they've all tolerated it really, really well. And it's massive change, like literally overnight.
So is it the drug experience itself that is healing, or is that combining that with, like, psychotherapy that makes it so powerful? Or, like, am I curing my dental phobic patients of their phobia by giving them ketamine
You probably are helping.
sedation?
You're
Okay,
probably
tell me
helping.
more. Tell me more about this. Can we
So,
start advertising? Well, it's like we're doing both.
yes. Exactly. Yes. We will decrease your phobias. You know what? I used to get people to sit with therapists all the time. I mean, that was one of my like go tos. We have these clinics, we have therapists and with the clinics. And gosh, here's the thing about therapy. How many therapists have you all been around?
Are you asking how
Like,
many times I've actually signed myself
not
up to go
personally.
to it because I really need to do
Help.
that?
I need help. How many have you worked with on a
Yeah.
professional
Oh,
level?
lots.
Yeah.
Yeah, so the thing with therapists that I noticed, and here's the thing with ketamine and psychedelic assisted psychotherapy. All therapists have their own opinions of what they should do. There's no standard of care. So some therapists are much better than others. Some therapists will try to meet their individual objectives as to what they think the client should do. And that's completely what you don't do. If anything, you sit there and you help them to feel safe. And that's my biggest thing. I'll tell people all the time, I need you to feel peace and calm and safety. So we had studies. We actually have had a couple of studies come out. One was with some neuroscientists from some Ivy League universities. Another was with Johns Hopkins and University of Florida. But we compared ketamine and then we did ketamine with therapy. The results were the same.
Interesting.
Mm.
Yep. I used to be a firm believer, but I have my own, like I've written 2 books. One's published, one's in the process of being published. But my personal opinion is there's a baseline thought process that you should have before you go into ketamine, and it allows the brain to do what it needs to do. But from an anti-inflammatory standpoint, I mean, they do say that ketamine has anti-inflammatory aspects. It does help with immune modulation. So I do think that it helps from a physiologic standpoint, but I think if you can get your brain to a psychologic standpoint, your results are so much more powerful. So, they'll tell you after one session that suicidality gets relieved 98% of the time. Me personally, I feel like people change 100% of the time, but it's trying to understand what the brain's doing to try to see that efficacy. And consistently, they'll say the efficacy is about 80 to 85%,
Okay.
which is about double than your meds, or 2x to 2.5x as what the med efficacies are out there.
Yeah. And
Wow.
so your protocol in your clinic is, and I'm assuming it's very patient dependent based on their presenting symptoms, concerns, things like that. Can you give us an idea of what you start with? Like, do you start with, okay,
Mhm.
we're going to do 6 sessions. And then how often are you doing that? How often are you spacing it? And is it a lifetime thing or is it a, short term thing that you recommend?
Everyone, so we do 6. We recommend 6 sessions, and it's interesting, right? So we've got Western medicine, and then you've got voodoo, right? So I actually lost my job. I don't know if I told you this before. I lost my
Yeah.
job over this clinic.
Yeah. So
I had to choose.
tell us that story first because I thought that was insanely interesting.
Yeah, so in 2018, my goal was to do the clinic and then just go part-time at the hospital. And because I just needed better work-life balance, which was not this company, by the way. But when I had to meet with my chief medical officer over the anesthesia group, and he was like, "We don't believe in mental health. Like, you're either going to do real medicine or you're going to do voodoo." And he's like, "You need to choose." And I was like,
Wow.
"Well, I guess I'm going to choose voodoo." And it was
Wow.
interesting because they just stopped giving me cases. I was full time. I was a full time salaried employee. They just stopped giving me cases until I fell off. So I never was fired. I was never terminated. I never quit. It just gave me more incentive to do this, which was interesting.
Toxicity of medicine. Come on. Like, what do you mean you don't believe in mental health?
Right. And now here's the fun thing about it. I tell people, I'm like, this is neuroscience.
Yeah.
It's consistently consistent. It's weird,
Mhm.
yes. But what else is weird is when they're like, I have mild depression symptoms. They're like, oh, try the Effexor. That's the first line that you should do. And I'm like, why would you get on a medicine for the rest of your life for mild symptoms instead of doing a one-time intervention? That's my piece.
Yeah.
Yeah, with
So
all the side effects that come with that one medication. You'll then treat with another medication and another one and another
yes,
one.
Or
Yeah.
come
it's
have your wisdom
horrible.
teeth out by me because evidently I have been running a ketamine clinic all along.
Exactly.
It's all how you market it, right? Like,
Yeah.
let's like wellness, vampire facials while you're getting splashed, and
Yeah, yeah.
ketamine
Exactly.
treatments.
My second book, Love, Safety, Trust. I will send it to you that you can give your patients before they have
Yes.
surgery and they could read the
Mhm.
book.
Yeah,
Yes, that's perfect.
yeah,
I mean, holistic dentistry, man. I'm all in.
that's
I'm
right.
all in. Just add some
Yeah.
ozone, will be like set.
Yeah.
Yeah. Yeah. We are
So
doing EBOO
then
around here too. I'm learning about that.
oh, I know, I can't wait to talk about that. So, you just decided, "Okay, that's great, you're not giving me any more cases, so I'm just showing up and sitting here, and
Yeah.
then
Well,
no thanks."
well, yeah. I just said, all right, I'm good, and I just went to the
Goodbye.
clinic and started. Yeah. And I've not been back. I've
I'm
been to the
just
hospital since
jealous that
2018.
you were smart enough to do a ketamine clinic when they were.
Well, I'm pretty sure they all thought I was crazy initially. And
Yeah.
now they're like, well, maybe
Mm,
she wasn't as crazy as we thought. Who knows? But here's the interesting thing. So 6 sessions over 2 to 3 weeks. When ketamine first came out, they said 6 sessions over 2 weeks. That was the nationwide protocol pretty much. And it was too much. I mean, some people probably still do that because that was the original protocol, but they were processing so much in such a short amount of time. So we switched to 6 over 3 weeks. And it was interesting because the way that they got that was they just compared it to ECT. ECT
Mm,
is 6 sessions over 2 weeks. And here's the other interesting thing that people just don't talk about is ECT is the gold standard for depression, right? Since 1950, ECT has
can you
been the
tell
gold
our
standard.
listeners what ECT is?
The electroconvulsive therapy, so shock therapy, right?
so
So when I did
crazy. Yeah.
anesthesia, I used to, because people are like, oh yeah, shock therapy, that's so cool. But here's the thing with it is when we sedate you, we give you a general anesthetic, we put a bite block in your mouth because you're going to grind your teeth, and we shock you to try to initiate a seizure. And that seizure, you need to seize for at least 10 seconds, but less than 60 seconds to get the most results. But you're screaming and everything else, it's horrible. But
It's so crazy that I mean, it must
it's
have
like
some
caveman.
benefit, but we
Yeah,
used to do that all the time in my anesthesia rotation. I did so many of those, and it's just like so unpleasant to watch.
yeah,
It
absolutely,
is. It
yeah.
And it's
creates,
crazy that
it is archaic.
shock therapy is the first thing, or you could go take some medicine that makes you feel pretty good in an IV. But the shock therapy, let's do that instead. My
Well,
goodness.
and so, right. So you kill the cells in order to promote new growth, right? Is what they think. But,
Okay.
the psychiatrist who I worked with when I was like, hey, I was reading about this ketamine stuff. What do you think? She's like, it's a fad. And I firmly believe it's not. But then there's 2 articles that came out in the last 2 years that said, and you all know our egos in medicine, it came out and said that ketamine is non-inferior to ECT. So
The
what that
wording,
just non-inferior.
non-inferior.
So so what they just said was ketamine's better than every big pharmaceutical thing out there, right? Because ECT is the gold standard. So if ECT is the gold standard, well, then big pharma came in in the 1960s and 70s per se with SSRIs and tricyclics and MAOIs. So if they came and just said ketamine's just as good as ECT, hey, big pharma.
Are
Right.
they giving ketamine? I feel like we always did propofol, but are they giving ketamine with ECT too? Because maybe that's
Honestly, I don't know.
confounding the results, you know? Like,
Yeah.
Right.
oh, this
I know
ECT is really working, and maybe it was the ketamine all along.
Yeah.
exactly. We used to not do that. But my piece, right, is if you go down rabbit holes and you look at general anesthetics, people who've had repetitive general anesthetics have huge increases of dementia. So if you're getting 6 general anesthetics with ECT over 2 weeks, and a lot of times I'm like, "How many ECT treatments have you had?" "Oh, I had 73." I'm like, "When did they think they were actually failing?" And they lose their memory. They'll tell
Yeah.
you that like less than
Yeah.
1% of people lose memory. That is such a lie. Because every person that I've ever had that's had ECT, I'm like, "Did you lose your memory?" 100% of them do. Because
Oh,
it's
yeah.
gross. You can't
Yeah.
control it where it's
Mhm.
Yeah,
going.
I saw that too with the patients. And it's crazy. Yeah, as you were talking, I was thinking the exact same thing. Like, so you can have anesthesia, which has some lingering negative brain effects, or you could have ketamine, which can do some of the
It's
same
pro.
things, but have a
Yeah.
pro. So
Mhm.
that's pretty crazy. And it's the conversation just about how we dig our heels in medicine sometimes, and we build our egos around things. And sometimes we just don't know, and how sometimes we don't want to give up our old ideals, even though the research shows. And one example in our field is like antibiotics for pre-meds for joints. Like, they're not really saying to do that anymore. They've been saying for the past like 10 years or more, and there's still so many people doing it. Like, well, I don't want to get sued, or better to do it than to not. And it just doesn't make
Yeah.
Right.
sense.
It's harmless.
Yeah.
Yeah.
Right.
Just
But
Yeah.
doesn't make sense.
there was a
Wow.
study that came out about antibiotics the other day. I was reading it and it was talking about like one round of antibiotics increases a person's symptoms of depression for like almost up to
Yeah.
40% in the
I
first year.
totally believe it. Yeah.
Wow. Well,
Like
it
the
makes
gut brain
sense because they
axis is
talk
so
about
strong.
how your
Yeah.
gut biome, what, affects serotonin or something. We're, like, finding out that it's like our second brain, our gut, and
Guess where most
so
of your serotonin is? Oh, maybe you all know this. It's in your cholesterol.
oh,
So it's like when we're giving these people all these anti-lipids and we're decreasing cholesterol, are we making their depression worse? I'm like, do any of
oh my
us
gosh,
actually know what we're doing?
there's so much we don't
Right.
know.
So
It's
much.
all intertwined, which is our whole bodies are systemic, and we forget that.
Yes.
We start
As it
thinking
turns
it's
out,
your emotional
everything's
side of your
connected.
brain is separate
Right.
from
Mm-hmm.
everything else, and it's not. It's
Right.
crazy. It's
And so,
absolutely crazy.
Yeah.
Katie, does the half-life of ketamine, so how if you're doing 6 sessions over about 3 weeks, the half-life is short, right?
Mm-hmm.
Okay. And so you're allowing for time for processing of the experience that you had. Is that kind of the thought process of it?
Yeah. So from the processing standpoint, like ketamine will kick in like 2 to 10 minutes. Like it's a slow onset. But then you start feeling different and you're like in this zone of thought, right? There's so much still that doesn't make sense to me. But when I discover it, it's like a little golden nugget I found. And so I tell people, you got your conscious thoughts and you got your subconscious thoughts, which maybe is completely voodoo when we say conscious versus subconscious. And I'll tell people, the only profession that looks at consciousness are those who sedate, right? So it's like you're awake or you're twilight or you're general anesthetic. Like those are the 3 levels of conscious. And it's interesting because different states have been like, oh, you're changing their consciousness. This needs to happen in a surgery center. I'm like, no, no, no. You're in a different level of consciousness when you're studying for an exam versus if you're playing in the field with your children, right? You're in a different level of mindset.
Yes.
And that's what it does. It changes your mindset. So ketamine really works on your subconscious mindset. So there's a statistic that came out that said 5% of all decisions we make in life are based on your conscious thoughts. 95 is your subconscious.
Hmm.
So I'll tell people the conscious brain is your actions and the subconscious is your reactions. So conscious brain is what am I going to wear today? When am I going to go to the grocery store? That's like the conscious thoughts, which is 5%, which if you think about talk therapy, that's the conscious brain. Like what's bothering you, and we tell people optionally what we think's bothering us. The subconscious is stupid, simple, strong. And they think like right now, they think that we're processing at least 22 emotions. They think that in every conversation, we're processing 22 emotions. And I'll tell people, on a good day, I might guess 5 that I'm processing right now. But think about all the sensory aspects that are going off right now. Like we're intaking light and sound and our temperature's changing, heart rate's changing. If there was an ant crawling on our ankle, we would feel that. So there's probably millions of subconscious processes that are going on.
Mhm.
And that's really who's ruling the roost. So when we try to like overanalyze and do all these other aspects, we're doing it through our little baby conscious brain. And we can't understand the power that maybe a color has, or a shape, or a rug. Just things that we would have never in a million years have guessed actually had impact. And I'll give you an example. We had a lady whose child passed away. We get a lot of acute loss here. And child passed away, and it'd been 10 years before she came to us. She'd been in trauma therapy for 10 years because the issue was not that he had died. The issue was that she was stuck and couldn't
Mm.
remember anything except the day that he died. No memories. And this was an 18-year-old child that died, right? So she had
Wow.
no memories prior to. During our ketamine session, and this was like 20 minutes into it, right? And here's 10 years of therapy, 20 minutes into ketamine. And she says, the rug in my living room keeps coming up. And she kept on trying to think about something else. She was sitting with a therapist trying to lead her somewhere else. And she's like, the rug keeps coming up. And we're like, all right, tell us about the rug. So she told us about the rug. What had happened is when the police came to her door to tell her that her son had passed away, she was staring at the rug. And that's where her sympathetic nervous system shut down. Once she processed the rug, all of her son's memories came back. Like, she started crying immediately, and
Wow.
she's like, and all of them came back. So it just got stuck. And, and if you're a mom who are like, hey, I lost my
Yeah.
18-year-old child to a traumatic event, and I really need to talk about the rug in my living room. You know what we would do? We'd probably just give you meds or go ahead and admit you.
Mm.
But that's what the subconscious was
Yeah.
stuck on. And so it's
Yeah.
those things to where
That's
a
so
lot of people
interesting.
are scared to death of ketamine. And I'm like, it is not going to bring up what you think it's going to.
Mhm.
My personal opinion is it brings up what grounded you during an event that took your control. So my personal
Mhm.
opinion, is the brain functions on the universal laws of physics. Like, every action has equal and opposite reaction. So when the brain hits conflict, it goes to polarities. So if it's a trauma or whatever you want to say, traumas take your control. What actually grounded you? So from what I can tell with ketamine will bring up the things that grounded you during that time that gave you control, but the brain makes all these different grids of connections. So every time you might have a hairband that you think about, and that hairband might remind you of, I don't know, when somebody pulled your hair out or something. But it's every time you see a hairband, you're like, I don't know why, you get all anxious. But the brain is not eclectic. It just moves so fast, it looks like it is, but it
Mhm.
makes connections on a subconscious level. So I'm like,
Mm.
I tell people, like, focus on the color, focus on the sounds, like,
Yeah.
and I'm like, reset that nervous system and all those sensors that are going off, which is completely what we don't talk about in mental health at all.
Can
Yeah,
you
it's
Yeah.
talk
interesting.
about some of the fears behind it? Like you said, some people are terrified by it. Some of the things I assume I was taught, Sarah was probably taught also, like contraindications. Don't use ketamine on people who have like antipsychotic medications, etc., like psychiatric illnesses. And that sounds so backwards from to what
Mhm.
you're
Like,
saying.
"Oh, this
Like
person
that's
has
a benefit to
PTSD. We
them.
stay away from
Yeah,
ketamine."
because
You're
it
like,
might
Mhm.
trigger a traumatic
"Right.
experience for them, and I've only had one really bad reaction on a patient, and this was a dental student when I was a resident, and I was taking out her wisdom teeth, and at the end, I hit her with a little ketamine, and she woke up screaming bloody murder, just screaming, screaming, screaming. It was terrible. It was really hard to calm her down, and at the end, she was like, "I thought I was in the planet of the apes, and I thought you guys were coming for me. You guys were the apes, and you were, like, chasing me down and trying to get me." And so, like, clearly there can be these negative experiences, and that's why
Like,
we have been
when was she
warned,
grounded in Planet of the Apes?" Right?
She probably just watched it.
Right.
Yeah.
so yeah, but what's your explanation for that? And should we be avoiding this in our patients with those diagnoses, or do you think it actually is okay for us to give ketamine to them in our clinic?
I think it's okay, but I think you have to be careful with the dosing aspects. My biggest thing is safety. Like, I'll tell people all the time, do you feel safe? Because if they don't feel safe, that's when they trigger, and God knows where they
Mhm,
go.
mhm.
But I think ketamine should be a first line treatment for PTSD, 100% all day long. Most people with PTSD, when they get ketamine, if dosed correctly, they feel peace. They feel like, oh my gosh, this is the first time I've had hope. And sometimes they'll cry when it's over. Like, it's crazy. But the ones that I'm very careful with are people who tell me that they're like bipolar 1 or they've had mania in the past. Because again, my personal opinion, I think the brain does one of two things. so fast, it just looks like a very complex algorithm. And ketamine slows it down enough to where you can try to see what that puzzle is doing. But people who have mania, dissociative identity disorders, they're living in the abstract space mostly. So
Mm.
like that whole concentric world, you have to like rebuild it for them. So when you give those individuals, you can still give them ketamine. But me personally, I give them enough to actually pull them from the abstract world. Because you don't want to give them enough to
Okay.
make them too abstract. You're trying to bring them back to baseline. You're trying to
Yeah.
make them neutral again. And it's
Yeah.
interesting, right? Because the people that you'll struggle with the most with ketamine are people who don't know how to sit in the present. There's a lot of people when they struggle with mental health, they are scared to death to sit in the present. They're always thinking about what they need to do next, and they don't know how to feel peace and relaxation. So if you have
Are you
those
talking about me?
individuals,
No, I was like, wait a minute.
is she in
As
my
we're
head?
talking, I'm like, what do I need to do next? I'm like, no,
I
come
know
back.
her.
Be in the moment. Be in the moment. Yeah.
Just focus on your breathing for a minute.
But well, I actually hear if you ever get people who freak out, all you do is you say, "Are you safe?" And they'll go, "No." And you'll say, "I need you to take 5 3-second breaths." And then that will pull them back in the present. Because if you have people who have panic attacks, people have panic attacks, they actually can't do low grade math problems and have a panic attack at the same time. So if somebody's having a panic attack, you're like, what's 1 plus 1? What's 1 plus 2? They cannot answer
Uh,
you and have the panic attack at the same time.
so
So that's
usually
your
they just
concrete
don't
and your
answer me,
abstract.
right? Or will they answer
They
me?
just stare at you.
I should ask them to do math, but I think they'll just be like, yeah.
But no, I tell people now because we run a pretty smooth clinic, but I tell everybody, I give them my TED talk before they start because let me tell you, this is huge. And I think this is really big. I think one of my skill sets in life is I can assess people pretty well. And, I think that was my anesthesia piece, right? Because we used to
Mhm.
paralyze people and would have to assess them before they would actually move. Well, now I actually have live talking bodies and it's amazing.
Yeah.
So I can really do a great assessment when they talk to me. But one thing I've noticed, and I think this is in mental health, I think this is just in everybody's health, is and it's my second book. It's called Love, Safety, Trust. And there's something big about love, safety, and trust. And from what I can tell with people, I do not think that mental health is random. Mental health issues, I do not think they're random. It seems to happen when people have an identity change, and it seems to happen within a 6-month interval. So it's usually, between the ages of 5 and 7, 11 to 14, when they graduate elementary school, middle school, high school, when they change jobs, when they move homes, when you have a child, when you get a dog. It's something that changes your day to day pattern. And that old identity's gone, right? It's dead. And you have to create a new one. Well, for a while, I was like, what the heck is in a new identity? But one thing I've noticed here at the clinic is the 3 things that come up the most: love, safety, trust. But it's an internal and an external aspect. So it's like, how do I know that I'm loved? How do I show others that I love them? How do I know I can trust myself? How do I know I can trust others? How do I know I'm safe? And how do I know that others are safe around me? If you can answer those 6 questions of those 3 topics in a new identity, it's almost like it recreates your North Star. And
Mm.
then you can start building momentum off of that. Because most of the time I'll tell people, because I'm like, I hate emotions. I mean, like, I love them when they're used appropriately, but when they're like controlling everything, they just need to go away
Mhm.
because they're useless. But, a lot of times I'll say, how do you love yourself? I don't. How can you trust yourself? I can't. How do you know you're safe? I'm not. I'm like, those are all 3 emotional answers. I need you to visualize what you think that would look like. So if people can start visualizing what they would want it to look like in this time of life, it's almost like the brain can reframe its narrative to where it is. And I think
Yeah.
that's the beautiful piece with that brain
It's like
plasticity.
manifesting, right? I mean, it's the same idea. Yeah, being able to visualize something and then,
Yeah.
like, because you're able to put yourself in that place, you're able to manifest that I am in that place. And so if I am in that place, this is what this looks like,
It's giving you
right?
some target, right? I'll tell people,
Yeah.
like, we just need to make a new map, like burn your old map. We're going to make
Mhm.
some new legends today and we're going to build a new map. But if they can't answer what love, safety, and trust look like, they're chasing a white rabbit. And the field posts are moving. So I'm like, do you feel like you're in a psychologically abusive relationship with yourself? And people are like, yes, and I'm like, okay, let's try to get some baseline definitions that this little brain can understand. And then it will start integrating and people start to feel like themselves again
So
in
is
a
Yeah.
this
better
something that's
version.
ever covered by insurance, or I'm assuming this is cash pay only?
cash pay unless you are in, and actually this says a lot, doesn't it? Blue Cross Blue Shield of Vermont and Blue Cross Blue Shield of Massachusetts covers it. So thank you,
Okay.
Harvard and Yale.
Progressive
Yes.
Northeasterners. Okay.
Yep.
Okay.
But I think Kaiser Permanente used to. I don't know if they do anymore. The VA covers it. The VA's been covering it for veterans since 2017. But the crappy part
Yeah.
about that is they make them fail 4 medications, and they also offer them ECT, and then they'll offer them ketamine as a 6th line.
Yeah.
Yes.
And think about how much financial drain
How much does it cost
is.
to do
Yeah.
6 general anesthesia? You know, like, oh my gosh,
Well,
like,
yeah. I mean, ECT, when I left in 2018, ECT was like $35,000
oh my
for 2
gosh.
weeks, right? And that's what
Yeah,
insurance is
sometimes
paying.
it's not sensical at all.
Yeah.
Yeah.
No, like
No.
none of it makes sense. So yeah, I went up against the Blue Cross Blue Shield Board of Tennessee, and I just knew I was going to win. I lost tremendously. Like,
No, come on,
I
Blue
was such a
Cross.
loser.
Let's
Yeah,
do
but
something good for
but they,
once.
I feel like they admired my stupidity, as I was arguing with the psychiatrists and their lawyers. But
But somebody has to plant the seed.
well, and there's a way, there's a process, and they told me which chapter book in their little thing, that I have to do in order to get that done. But it needs to happen, right? I mean, I charge like $360 for a session, and you don't really hear that. That's a pretty low number.
Oh, yeah.
The average cost is $500 to $800 per session.
Oh, yeah, definitely.
Yeah, because I mean it's an IV and it's malpractice. You're still having to get anesthesia malpractice, things like that stuff too. So when the other psychedelics come in, and here's the fun part. This tells you, I don't know, as we get older, do just people get stupider, or do we just become aware of their stupidity? I mean, that's where I'm at. But, Medicare has a psychedelic CPT code that was created in
Really?
2024. But here's the fun part. There's no accepted definition of what a psychedelic is to this day. We've had a code for 2.5 years, but apparently they're going to start covering it. They were planning on MDMA in 2024 to get
Wow.
approved. And it got denied. And they're repeating the phase 3 trials. And it only got denied because the people who I greatly love who helped to lead MDMA initially are just a big bunch of hippies who thought the FDA was stupid. And the FDA ate them, kind of. But they were very supportive and said, go back, redo. Because they didn't track, the rate of diversion. And they didn't track addiction at all.
Right.
They didn't have the data at all. They were just like, nobody gets addicted. Well, where's the data?
Yeah, right.
We
So,
didn't track it.
can you talk more about the other psychedelics?
That's what I was going
I
to say,
assume
because
they have
ibogaine
their
doesn't have
own.
that addictive
Mhm.
capability, right?
Right.
Mhm.
I assume they have their
Well,
own profiles, their own benefits, pros and cons. Is that true? Or are they all kind of doing the same thing? Or are there some diagnoses that like mushrooms are good for this and MDMA is good for that? What if someone's curious in seeking out these treatment options? How do you narrow down to the one that's best for you? Does it even matter, or you just kind of dabble and see how it goes? What's the thought process?
I feel like most of the world dabbles and sees how it goes. But, from a legality standpoint, I mean, ketamine's legal everywhere, right? Across the world, across the country. It's legal. But, it's IV. Now there is home ketamine. You got to be careful with that because some of those physicians are given bigger than general anesthetic doses for at home use.
Ooh. Mm.
Yeah, like really big doses, which shouldn't happen. But whatever. Each their own. But ibogaine. So ibogaine is Trump did sign an executive order about a month ago that is going to help to reschedule psychedelics from Schedule 1 to Schedule 3, which is what ketamine is. But, they're all still illegal, I guess, to a point. But ibogaine, through a lot of different states, has been getting a lot of approval for a lot of research dollars. So what you have to be careful about with ibogaine, and because right now it's most people go to Mexico, and there's a lot of veterans that are actually participating with ibogaine. It's changing their life. But what scares me the most with ibogaine is ibogaine's cardiotoxic right now. So it leads to torsades or asystole. It can, and it's like 1 in 400 people it can happen to. But there is an amazing researcher at Columbia University who made ibogaine cardiosafe. And I met him in 2024, and he said it's going to go into human research in 2026. So I'm guessing that's why they're doing this big push right now, because Texas just put $100 million into ibogaine research.
Yeah.
So I'm hoping that Dollymore Thames is this guy's name, who's just an amazing. He's been working on it since 2013. So that's what I'm hoping with ibogaine. But ibogaine after one session, right, is treating addiction almost 90% of the time. after one session. But Ibogaine can last, 12 to 36 hours. It's a pretty intense session.
Yeah.
So Ibogaine's good for, I think addiction's probably the biggest thing they're going to look at, but it's helping with all of them. We did have a study that came out that showed that PTSD symptoms and depression, anxiety, insomnia, they all run together. And so Ibogaine is the hardest, I'm going to say, psychedelic that's out there. LSD, the Netherlands has a lot of good studies with LSD to where it's actually helping to address anxiety. And somehow they've got it down to where it's a 20-minute session with LSD.
Wow.
Psilocybin probably has the most data. Johns Hopkins has the most data with psilocybin. Psilocybin is probably the most gentle psychedelic there is. And there is microdosing that a lot of people participate in that helps with, depression. And the thing with that, there is a lot of recommendations for the microdosing, but what you have to be careful with psilocybin is psilocybin actually stimulates beta cell production. So if you're on psilocybin, they'll just tell you like, do not microdose every day because your beta cells, right, mostly in your heart. And if you have valve insufficiencies, it can actually make heart disease worse. So I always tell people if you want to do microdosing, which is completely illegal in Tennessee, follow up with a cardiologist, get them to do an echocardiogram on you and just do a baseline. But psilocybin, the big doses of psilocybin is helping people tremendously. I would say it helps the most with depression is probably one of the biggest things that psilocybin is helping with. MDMA, which is ecstasy, is helping a lot with PTSD. But honestly, I think all the psychedelics are helping. They're cross-correlating. It just depends. Are they working on the dopaminergic, serotonergic, glutaminergic? Like where are the little guys, where are they working? And ketamine will be under that psychedelic umbrella as well.
Okay.
But the communities, they want it all to be natural, but they don't understand that, digoxin's natural, opium's natural, cocaine's natural. Just because it's natural does not make it safe. And the
Yeah.
community feels like that is safer,
Right.
and it's not. But I think it's going to be an exciting few years. I think it'll give people a lot of hope once we get there.
So when things become legal, are you just like biting at the bit to add those into your clinic?
Absolutely. Yeah, Tennessee, believe it or not, just approved Ibogaine for research that started July 1st.
I heard
So yeah,
that.
so
That's
we've
awesome.
got the building to actually do it, but it's going to change. I mean, like there's a lot of bad people in the mental health space, like in the addiction communities, and the rehabs, and you just hear horrible trauma stories.
Yeah.
I feel like that's what's going to happen in the psychedelic space as well. There's going to be a lot of bad that comes because there's going to be so much money in it. But there's so many healers that are out there. And, and that's something I went through. And that could be another podcast to where I took this company public and got greatly taken advantage of from a financial standpoint, to where there was a lot of psychedelic companies on the Canadian exchange because you can't be a psychedelic company in the US because it wasn't federally legal.
Right.
But you could in Canada. All those companies went bankrupt except mine. Mine's just a shell. I resigned from it in January. I was with it for 5 years and I gave everything. I gave my marriage. I gave my 401k. I gave everything to this. And I was just left with the bag after I got pumped and dumped. And there was over $1 billion invested in the psychedelic space in Canada and they lost it. Like there's a lot of people who made a lot of money off of that, but it was a scam.
Wow.
So I feel like that's what's going to happen for a while until people can learn from it.
Yeah. Well, and I also think too, you got into the ketamine clinic space pretty early on. I feel like there was this big boom of ketamine clinics popping up everywhere. And it's like, ooh, when something happens like that, it's like the cannabis stores and things. And then like, that's only going to be so long before there's winners and losers. And there's very few winners and a lot of losers. But then you also wonder the people that are being treated at those places, how are they doing and how is it legit and are they dosing them appropriately? And so I think that's where a lot of the skepticism, at least from what I understand, like when I'm talking to people, that's a lot of where the skepticism comes in, is because there was a big boom and then it was like, oh.
Yeah. 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 I mean, it's been interesting. You've had to evolve. I mean, I've had to evolve a lot, but fortunately, I don't know. I think we've had like 6 or 7 papers published, in pretty big journals and just learning from it and trying to be a leader in it. But if you were in it just for the, thinking you're going to make money, I mean, like I have lost millions of dollars on this company. I have not made, I could be back at the hospital making like 10x as to what I make now, paying off a lot less debt. But I think that the value of it, we'll get there. But gosh, there's been so many people. I have no doubt that people have killed themselves, like clients and people running businesses. Like it's just been nasty
Mm,
because you see it, right? You
Yeah.
see the results. But then people are like, oh my gosh, look at the margins. And then you get, oh my gosh, I have dealt with, I didn't even know they made people like this in life, that are, as somebody told me, they said, well, you know what a con artist is? You know what's called a con artist? They're convincing. And,
right.
yeah, and that's something in medicine that when you come out and you start doing these things, you gotta be so careful because I'm like, why wouldn't you wanna help adolescents? Why wouldn't you wanna help first responders and veterans? And they don't care. They
Right.
want money. And I have
Mhm.
been a lot of people's pony, that has danced and brought in a lot of money because people trust me because I'm doing it for the right reason.
Mm.
But it's the people in the back end that, like, I'm getting a lot tougher now than what I once was. But,
Yeah.
gosh, it's a nasty world out there.
Mhm. Yeah. Yeah, and so what other things are you guys doing? Because do you have 2 clinics?
Mhm.
Knoxville and Johnson City? Okay.
Yep.
And then what all are you guys doing?
We have vitamin infusions, which I used to not believe in at all. Now I'm a firm believer. We do like high dose vitamin C. Amazing. We do glutathione, the Myers cocktail, which is just a multivitamin. The reason those work though is because they're 100% absorbed on a cellular level. So way different than if you take them by mouth. The max you can absorb when you take it by mouth is 40%. So, we do vitamins. I've started doing med management. I used to be completely against that until I saw actually how bad the management of the medications were. So now we actually do med management to try to taper people off to maybe put them on more natural things. So we have our own supplement lines with mushrooms, like the legal mushrooms. So cordyceps, reishi, lion's mane, those different things. And then we also have EBOO, which is EBOO, which is one of our new things, and it's extracorporeal blood oxygenation and ozonation. And
Tell us about
actually,
this.
you do bilateral IVs, and it circulates 3 liters of blood over the course of an hour. But you ozone people, so you give them O3, right, for a while. And it does a lot of different things. It was really interesting because I got trained by a naturopath, and as he was talking to me, I was like, this sounds like ECMO. And he's
Mhm.
like, well, we don't have any studies comparing ECMO versus EBOO. And I'm like, but you should because ECMO is very validated in the medical community.
Yeah.
And but what it seems is that EBOO it's the FDA has said that you can say that it helps with inflammation. They have said that, which I think is a huge for the FDA to say that. But it was a nephrologist who actually created it in the 1990s. And it helps, from what I can tell, to clean the blood. It's a filter. It looks like a dialysis filter kind of
Mhm.
thing. But it will take out plaque. And then it helps with, it breaks down biofilms,
Okay.
which I didn't really know much about biofilms.
We know all about biofilms. That's
You
a
do?
Oh,
That's a
yeah.
big thing?
Well, that's like
Yeah.
dentistry in general, right?
Yeah, so so
Yeah.
so EBOO the ozone takes down biofilms, so but it also helps with, like, your reactive oxidation species, so if you get that, and then it starts leading to cancers and all the other long-term effects. So we actually do EBOO, and then we give people, vitamin C that actually helps to oxidize some free radicals, so it will help to decrease a lot of those different aspects of it. The people I've had, I've seen lots of plaque, like cholesterol, like stuck. I don't know if you ever used to draw blood on people and you see the cholesterol float to the top of the vials. You'll see that actually stuck. The filter will catch that. But it's interesting though too, because you'll see people, they'll be like, "Oh, I did EBOO and I pulled out a clot and the clot was like 18 inches." And I was like, before I went to training, I was like, I just don't think that that is physiologically possible. Like they would be dead if you had an 18-inch clot come out. And so it does take out fluid, and the fluid's supposed to be clear, but it takes off cellular inflammation. So a lady, she has horrible lung issues, but we took off 450 cc's off of her in an hour. And this was like 2 hours ago. That's why I have a different shirt on. But if you see
Interesting.
people who are doing EBOO, and if they have long clots, or if they have that clear fluid that's yellow, and they're like, this is all the toxins in your blood.
Right.
If you see clots or if you see yellow with your inflammation, they're breaking down your blood cells. They're hemolyzing your blood cells. That's what the yellow is. So they're being way too aggressive with the ozone. So, but it does. I mean, we've got a 16-year-old right now who we're treating who has chronic mono. She's missed school. She did it one time and she felt completely different.
Yeah.
And this is an
Interesting.
hour-long session. Yeah.
Yeah.
So I think there's a lot of good to it, but I just
Mhm.
have to figure out how to translate it from the naturopathic world into the Western medicine world and try to figure out actually what's really going on.
Yeah.
Sure.
Yeah,
Yeah.
but it's fun. It's like a little, I don't
Yeah.
know, it's a little puzzle of life.
Yes. Yeah.
Mhm.
Wow. It's cool. So the way that I met Katie was one of our friends was introduced to you during a postpartum spell where she was just having a horrible time. And she knew that she was going to have a horrible time because she had a horrible time the first time. And the second time, she was prepared. She like set up all of her support system. She was ready to go. And again, postpartum anxiety, depression is incredibly strong and resilient to all the things we tried to change about it. And so she, I think, had reached the end of her rope, had gone and tried the medication she tried last time. She tried a different medication that has just been approved. That also did not work. And she was just hopeless, right? And she found you and was treated by you at Revitalist. And the first session, I think, had a good experience, had a really interesting, like visual stimulus that she was visualizing and but didn't necessarily feel relief from a soul perspective. But after the second session, that really clicked for her. And then after that, talking with her was earth shattering to me because it was night and day. I mean, just insane. And so then I went and visited her and I wanted to come meet you. And so she had a session scheduled. So I got to sit in. Thank you for letting me do this. I got to sit in on the session with her and I asked her questions during the whole thing and I kind of let her guide me because I had no idea what to expect, right? I mean, I give ketamine all the time and I just like
Mhm.
still didn't know what at all to expect. I was like, are you aware? Are you able to talk? Are you, all of the questions.
Uh-huh.
And it was just the most amazing experience. And I was on the other side of the room and I'm in tears. You know what I mean? Just being in the presence because I could feel it because I'm such a but I could feel it coming from her too. You know what I mean? Like, and I just could, like, all of the things she was saying, I just could feel them. And it was just it was something so incredible that is so hard to describe and really sounds woo woo, but her mindset shift and the change in her ability to communicate and to experience life shifted so dramatically that I was like, there's something here that is powerful and needs to be talked about more because everybody that I talked to about it was like, "Ooh, that's scary. I don't know. I don't think that that's appropriate. I think that that's going too far. Like, shouldn't she just get on medication?" I'm like, "You're going to make somebody sit on medication that doesn't work for a lifetime as opposed to having this and having this life-changing thing." And they're like, "Well, isn't she just going to relapse?" I mean, it's hormones, right? So they're just going to come back and attack,
Needs to eat
you
her
know?
placenta.
Yeah, exactly. Capsulize that thing.
Right?
And so or encapsulate that thing, whatever they call it. But yeah, so how you must see this all of the time. And what have been your successes? And also, have you seen people that aren't that it doesn't help? Because I've heard of patients like or people like that too. I don't know them, but I've heard from friends of patients that have had ketamine therapy and it didn't really seem to matter.
Yeah. Yeah. No, I mean, I'll tell you my hardest clients. My hardest clients are people who have been on a million medicines for the last 40 years. If people have critical thinking skills, they're going to do well with ketamine. And I always ask people, I'm like, what's your profession? If they're like, I'm a surgeon, I'm like, oh, you'll do great. Because they have the skill sets to be a constant and have variables. So it's like if I go into work today, this is what I'm expecting to do baseline, but you're gonna have all these variables that you're gonna have to deal with. And that's what ketamine does. It gives you a base, but then it gives you variables. And then I'm gonna tell people it's data, right? It's just data that comes up and there's no narrative attached to it. So if you can see the data, then you can reframe the narrative. But the issue is sometimes the narrative goes first and then we have the emotion secondary. And that's a big piece of it. But people that are hard are the people that don't expect. I know this sounds crappy probably, but it's the people that don't expect to have emotions. So, we're expected to have all emotions, right? Joy, despair, love, sadness, all of them. That's life. People who so I treat a lot of people who have addictions, and they make a emotional connection with a substance, right? And that
Mhm.
substance will come when they need to. So it's giving them a certain sense of control. When you start drinking or having a sex addiction or whatever else, your emotions go to that addiction. So you don't have normal emotions. So they stop making emotions. That's why people that are sober or, who are trying to be abstinent or whatever else, it's so hard for them because they feel emotions and they don't know what to do with them.
Mhm.
So you have to normalize with people, like, it's okay to feel sad. It doesn't mean that you need to go drink. It doesn't mean that you're depressed. Sadness is normal. And what kills me is in the mental health space, we're so freaking smart that we think that it's cool to make mental health feel unreachable.
Mhm.
So I try when people are like, "I feel sad." I'm like, "What did the sadness feel like? Did it feel like true sadness? Were you crying over something? Did it feel like despair? Did it feel like hopelessness? Did it feel like you were, grieving something? Like, what did it feel like?" So I try to figure out what tangible action is this feeling actually coming from? Because I believe it's all connected. We just have to figure out where it's coming from.
Mhm.
But, but that's the biggest piece. I mean, if you have people that are, on 5 to 7 milligrams of Xanax a day, gosh, they're hard. There's nothing
Because they've
there.
not
It's like
experienced they've been, like, muted, right? And so they're just here, and so
nothing.
they don't know
Yes.
how to experience any shift from
Yes.
that.
And it's all blocked, right? So, but if you give me a veteran who has anhedonia, like all day long, I can help them to get their emotions back. And then we can start to understand them. So I'll tell
Are you
them, I'm
talking to
like,
me?
Oh, yeah.
again.
Veteran.
But it's the thing about it, right? Is like you have to you have to understand it before you can agree or disagree with it. And a lot of times people are trying to either promote or suppress. No, stop. And the thing, and I tell people too, the law of conservative energy, right? Energy is not created nor destroyed, it's only transferred. So if I'm sitting there and I'm like, I don't know why I have so much fear. I'm not a fearful person. Like, I don't want to have fear. Like, and you're focused, right? You're focused so much on not being fearful. Like, what's the opposite of fear? Right? And believe it or not, the opposite of fear is love. I'm like, okay, so why don't you go over here to the love section and let's think about how can I love myself? How can I love others? And if your brain's truly, right, if it's truly doing Newton's laws of physics where every action has equal and opposite reaction, if it's going to the polarities and it's staying at the polarities until you can build that critical thinking spectrum, like if you're over here, build over here and then move your little ball to the middle to where it's neutral. And that's what I'll tell people. I'm like, I want you to feel so neutral that when you're sitting in the middle, you see far right Republicans and you see far left Democrats and you think, my gosh, each of them have excellent viewpoints. That's what you want, right? And that's what talk
Mhm.
therapy is about, is trying to get people to see the far right and the far left. That's it. And ketamine will shove them right there in the middle. And, because people will be like, I don't know how to meditate. I'm like, oh, don't worry. You'll get there. So they're sitting there and like, I'm not connected to anything. And exactly. That's the goal. Because depression, anxiety, trauma, it's all become narratives to protect you. And
Mm.
protection isn't always good. So if we can
Right.
make you neutral, and I've actually been using this analogy a lot lately to where, because my brain thinks in pictures, I'm much better with pictures than words.
Mhm.
But I'll tell people, say if I have a female and I'm like, I want to protect her, I'm going to put her in this bedroom forever. And I'm going to bring her food so she's safe and she has water. It's like, no, that's abusive behavior. You might think it's
Mhm.
protection, but you're abusing the person.
Yeah.
So you've got to disconnect from it.
Yeah.
And then you have to, but it's so interesting. That brain, either with anxiety, it gets stuck in the future, or with depression, it stays stuck in the past. And those become the protection. So if you detach from that and you sit in the present and you go, oh my gosh, this is the first time I've ever been able to feel peace and calm since I don't know when. The brain can then duplicate that. It's just like muscle memory. It's behavioral memory. We all have behavioral memory, but a lot of times those behaviors that once served us are no longer serving us. But your friend that you were talking about, this is one thing I loved about her, because I had no idea that she was a oral surgeon. No idea. And when she came in, I was like, "No, she doesn't sound like an oral surgeon." Because you all have, like surgeons, you naturally have this power. Like, period. You just do. Session 3, I heard her come in, I was like, there she is.
Yeah.
She was projecting this sense of confidence, and I'm like, there's the oral surgeon right there. She's doing better. Like, I could just tell just from that, because she came and she was just so defeated. and that's what happens is people come to us and they're like, you're my last hope. Like, I mean, I get people who are like, I'm scheduled for the physician assisted suicide, and then Canada, the Netherlands are like, you're my last hope. And I'm like, all right,
Oh
come on,
gosh.
let's go. So we get a lot of those, but the crappy part is like, why do we have to go there? Like,
Right.
why do we have to be that bad? Can you please come to me when you're like, I have not slept well in 2 weeks? I'm like, perfect. I don't get those yet. I get the ones who are
So
like, white flag.
those of
Yeah.
No.
us who want to come and see you, not all
Yes,
of us
come
have
on.
access to a ketamine clinic. Maybe we just have really fallen in love with you and we would love to come see you. Is
Come to
it something
Knoxville.
where I have to come for 2 weeks and do the whole protocol? Do I benefit from getting a couple sessions in while I'm there? What do you talk to? What's the recommendation for people who want to travel to see someone like you or
I
another
love that.
clinic that they trust somewhere else?
I always tell people try to do the 6, but if people wanted to come to me and some is better than none, period. Right. So if people could come and do 2, over a weekend or whatever else, because we are open 6 days a week, then that way they can at least see the base as to what to expect. And then if they wanted to go somewhere else, and the ketamine community is a pretty small community. I mean, I've been around long enough to where I know some of the people, or if anything, they'll at least talk to me typically. So we work in collaboration with a lot of clinics, but I've had people fly in from Washington or Hawaii.
Do you think is it the timeline that's more important or the number of sessions? Like if you did 6 sessions total over 6 months, is that going to have a benefit or is it like the 2 weeks, the 3 weeks is really what matters the most?
So right now the recommendation is 6 over 3 weeks. I'll tell people 6 over 4 weeks, but it's the time frame. So what's happening from a physiologic standpoint, ketamine peaks when you're giving them half a mg per kilo. It peaks at 40 minutes. And what it's doing is it's partially antagonizing your NMDA receptors. And when it does that, you get an excess of glutamate. Glutamate stimulates something called BDNF, the brain derived neurotrophic factors. Those continue for the next 48 hours.
Okay.
So what I'm trying to do is I'm trying to re-stimulate that. It's almost like a loading dose. I'm
Mm.
trying to re-stimulate that process once every 2 to 3 days in order to truly get the physiologic benefit from it. Do I think that people could benefit from one time if they had a great base of meditation and understanding all that? Absolutely. And hopefully the book when it comes out that will help people to guide them because
Okay.
it's pretty complex, simple but complex. But yeah, no,
So
all day
interesting.
long people can come here, or I can
Okay.
talk to whomever across the
Yeah. Well,
country.
it's been such a joy and so fascinating talking to
Yeah.
you. Can you tell people how we find you? Do you have an online presence? How do we find your clinic? What can we do to keep up with you more?
So, revitalist.com is my website, but I am on Instagram a lot and Facebook with videos. I do my 90-second videos talking about something, and Instagram keeps changing their algorithm to try to incentivize me. So you're going to see more of me because I've learned if I don't
It
do it,
incentivizes you? Me, I'm like, I'm done.
oh no, let me tell you. Here's my 8.5 years of experience now. If you don't do it, they will make your profile more private. If you
Yeah,
keep doing
sure.
it, they make it bigger. Yeah, it's not fun. But yeah, so when people are like, why are you so narcissistic doing all these videos all the time? Instagram makes me do it. But yeah, I'm catwalk1217 on Instagram. And then actually I had a ketamine video get like, I don't know, 22 shares yesterday, which was pretty big.
Yeah.
But social media, I mean, people can call. I've got a guy named Mario. Everybody loves Mario. And he'll hook up and connect whomever he needs to try to get people help. But yeah, they can call. They can
And you
always
can go
call.
anywhere, but you only get Adonis if you go to Revitalist.
That's
Found
right.
you.
You only
Yeah.
see there in
Yeah. I'll
my
share
red
pictures
dress.
of Adonis also.
Yeah, I do have it. Yeah, I've got Erin. I've got
So
rescued Great
cute.
Danes, and
So
Adonis
cute.
is a big puppy.
I
Big boy.
see. Is he the gray one?
Yes.
No, that's Max.
Uh,
You have to scroll
Wow.
down.
Don't worry.
I'll
Yeah.
send.
All right, I'll find him.
I'll put it as one of the video
There you
covers. You're
go.
gonna love it. It's gonna be great.
Sarah's got it.
Cute.
Yeah.
Cute.
Mhm.
But yes,
Okay.
we also have dogs. It's probably not the ketamine. It's probably just the dogs.
Maybe.
Probably.
Yeah,
You're probably
maybe.
right.
Yeah.
Awesome.
But
Well,
I
thank you
thank you
so
so much for
much.
having me.
Yeah,
Yeah, I
Yeah, I
this has
really
really
just been
appreciate
appreciate
great,
it.
it.
and it's eye-opening, and I just hope that it becomes more and more of an accepted alternative therapy and stop with the $35,000 treatments if
CT,
you can just
come
do
on.
this. I mean, it just is insane, so, and after having witnessed it in person, not on myself, but on
Yeah.
someone else, I'm just converted.
Okay,
I'm a believer.
can I tell my crazy ECT story from residency? Last
Yes.
thing for all the people waiting till the end. So this woman, she was having these delusions, like satanic delusions. And she thought like Satan was after her and all this like scary
He
stuff.
is. He's
And
always after
so
you.
you're right. He's
She
after all
wasn't
of us.
wrong.
Me.
So she was getting ECT therapy and they put the bite block in, but she had all on 4 bridge on the bottom. So for people who don't know what that is, she had dental implants that were supporting her teeth and there were some gaps. And so when her tongue thrust forward because of the shock, it shoved the tongue through the implants and completely split her tongue down the middle. So she woke up with a forked tongue. And they're like, this is exact wrong person to wake up with a forked tongue because she's already like freaking out about
Amazing.
like satanic forked tongue imagery stuff. So they're like, can you suture this up? So there you go. Let's stop doing that and let's do ketamine.
Hey, your
instead.
story just stopped it all right there. That
There it
was
was.
beautiful.
Yeah.
I was like,
I'll
I
follow
have a
up with
story
my
for this. I
my
forgot
less
until
exciting
now.
story. Because my ketamine story, when I realized how powerful ketamine was I was on my anesthesia rotation at Parkland, and we did a lot of inmates. And I remember waking one of them up, and it was a really nice wake up. And he says, "Doc, you gave me some of that special K, didn't you?" And I was like, "Oh, how did you know?" I had no idea. I just am so naive. I had no idea, but I was like, this must be something pretty special. So it's no
I
forked
mean, they
tongue,
call
but
it that for
quite
a
an
reason,
endorsement.
right?
He said he knew all
Or
your secrets.
the horse tranquilizer, they always call it that too. So anyway.
Yep. Well, and I tell people, here's a tidbit. It's horse tranquilizer and cat Valium. It's used on all of our pets because it's so safe. It's not going to kill you.
That's true. That's a good
Safety.
point.
Yep.
That's a good point.
Gonna use that one.
And we're hopefully not giving you the horse dosing, so it's
Right.
even more safe.
Exactly. No
Yeah.
Matthew Perry doses here.
Yes.
No.
Don't do that.
Okay. Well, thank
All
you so
right.
much for joining us. Another episode of the Resting Stitch Face podcast. As always, please like, share, and follow. And we'll catch you next time.
See ya.